Children are a unique entity. You cannot treat them as small adults. They need specialized eye care. So let's talk about refractive errors and lazy eyes in children. Refractive errors are not like refractive errors in adults. They need to be corrected in time and they need to be corrected fully. If we do not do that in children, they would lose vision. They would develop what is called a lazy eye. It's a common misconception among parents that once you give them glasses, they have to continue using it for life. That may be so, may not be so. Sometimes we give glasses for improvement of vision. Sometimes we give glasses to relieve eye strain. Let's understand why glasses are so important. Consider the eye as a camera. Unless the lens and the photographic film are in correct alignment with each other, you would not get a clear photo. If the lens is canted to one side, you would get a photo that is fuzzed. If the film is not located at a proper distance from the lens, you would again get a blurred photo. Consider the eye as a biological camera. The retina, which is the photofilm of the eye, has to be at a perfect distance from the crystalline lens of the eye. If that does not happen, you get what is called a refractive error. This refractive error leads to a blurred vision. Blurred vision in turn leads to an improper connection between the eye and the brain, especially in children less than 8 years of age. These children tend to develop what is called lazy eye or amblyopia. If we do not give them glasses in proper time, they would end up having poor vision for the rest of their life. Now let's come to a less serious situation. They do have a refractive error, but they are not using or wearing the glasses, or they are not aware of the same. This could happen because children are not small adults. They would not complain. Instead, what would happen is that they would try to go closer to the board, or they would lose interest in studies. They may develop eye strain, they may complain of headaches, they may develop frequent attacks of red eye. So how do we diagnose refractive errors in children? Older children may complain. Children who are born premature need to be routinely screened at around 1 year of age. Children of parents who have high refractive errors also need to be screened. And all children should have at least one eye examination by a pediatric ophthalmologist before the time they enter school. That is around 3 to 4 years of age, before the time they would go to play school or preschool. They need to have an eye exam by a qualified pediatric ophthalmologist. This would help us ensure that none of these kids who need glasses are deprived of them. Cataracts in children can be quite serious. They can occur as early as 3 to 4 weeks of age when they are called a congenital cataract. Sometimes they may be present at birth. Unless we operate on them early, they would be deprived of useful vision for the rest of their life. So how do we treat cataracts in children? Surgery is the only option for pediatric cataracts. We have modern equipment, we have modern anesthesia techniques. This permits us to operate on children as young as 4 to 6 weeks of age. We also have modern intraocular lenses, and we are able to implant intraocular lenses in children as young as 6 months of age. For children who do not receive an intraocular lens, we have excellent glasses for them. But believe me, if you do not get the child to a pediatric ophthalmologist on time, you have already missed the bus, and there's little that we can do to improve vision. So the only solution for treating pediatric cataracts is get them early to a pediatric ophthalmologist and ensure surgery at the earliest. Ocular infections occur very commonly in children. Most often these children come with conjunctivitis. The conjunctivitis, or Madras eye as we call it, spreads very rapidly among children, primarily because of poor hand hygiene. So it is a misconception that the conjunctivitis or Madras eye spreads between children merely by looking. It spreads usually by sharing towels, handkerchiefs, and also by what we call as in the medical jargon as fomites. Fomites merely mean objects. For example, if a child is infected with conjunctivitis and he or she touches a book, the other child also touches the same book and rubs his or her eye, then the virus, the conjunctivitis is most commonly caused by a virus. The virus would spread from one child to another. So these outbreaks of conjunctivitis are very common in public places, in hostels, and also in schools. So the emphasis should be on hand hygiene. Children less than 1 year of age, please make sure that whoever handles them washes his or her hands properly with either hand sanitizer or with soap before handling these children. Once again, abuse of steroids should be avoided in conjunctivitis. It is recommended that you use medicines only on the advice of a pediatric ophthalmologist. Never purchase it from the medical shop and use, and also only for the time that has been recommended. So whenever your child develops a squint, you have 2 or 3 bad things that are going on. One, of course, is the cosmetic blemish that the child would face in school. The second is that binocularity or 3-dimensional vision is gone. The third is that if you do not treat squint or strabismus, you run the risk of developing a lazy eye. Now consider that you have a child who has his or her left eye squinting. So over a period of time, what the child's brain would do is that the child's brain would get locked onto the right eye, will start ignoring the left eye, and the left eye would gradually start losing vision. So how do we treat strabismus? So that is important, because only a qualified pediatric ophthalmologist can treat strabismus to its fullest. For some children, they do very well with glasses alone. For some, we give patching. By patching, we start covering the good eye with a skin-friendly sticker. So this improves vision in the left eye. It may bring the deviating eye into alignment. For others, we have strabismus surgery. Now, once again, when I mention strabismus surgery for squinting in children, parents give a reaction of shock. My child, does it have to be surgery? I mean, after all, it's considered as a sign of good luck, but I have already explained why it is not so. Strabismus surgery these days has become very safe with the advent of excellent anesthesia equipment and personnel. So operating on these children means that your child is not going to have any pain. The eye could be sore for a day or two. And whenever I operate patients on a Friday, I usually pack them off to school by Monday or maximum by Tuesday. So bow and arrow injury by either custom-made bow and arrow or whatever is available in the shop should preferably not be given to children, or if at all the child has to use it, should only do so under adult supervision. And they should never have any arrows with sharp edges on them. So this very often is forgotten, and this bow and arrow injury, unfortunately, sometimes bows and arrows made from a broomstick, the broomstick has all the bacteria, all the dirt from the house in it. So whenever it hits the child's eye, it could transmit all kinds of the bad bacteria into the child's eye, and your child could end up losing vision. For the milder forms, they may develop what is called a cataract. The severe forms of bow and arrow injury can end up with endophthalmitis, which is an infection of the eye, which could essentially eat up or completely destroy your child's eye. The other reason why children get injuries is use of firecrackers without adult supervision and without protective eyewear. I would recommend that all children, and for that matter all adults, should use firecrackers only after wearing protective eyewear, and all children should do so only under adult supervision. Keep all harmful chemicals and tuna, etc. out of the reach of children. Sometimes we do get children who have literally burned their eye because the tuna that they were trying to open, the tuna that is used on pan that they were trying to open, accidentally spilled on the child's eye. So these are three common ways in which children can get injury, and the most unfortunate thing is that even though these are perfectly avoidable, the parents hardly understand the seriousness until his or her own child gets it. And if your child does happen to get an eye injury, please do not attempt to do anything yourself. It's better that you get them to the attention of a pediatric ophthalmologist at the earliest. And further, if your child has a chemical injury, wash the eye with copious amounts of tap water or whatever water you can get. Please make sure that it is washed before the child comes to the attention of a pediatric ophthalmologist. If you do that, and if you get these children to a pediatric ophthalmologist at the earliest, you may end up preventing a child's vision loss. Remember, if an adult loses vision, there are only so many years he's going to live. But if the child loses vision, the child has to be visually impaired for the rest of his or her own life. And when it is an avoidable injury, please do attempt to avoid it.